Okay, there we go. So thank you all for joining me today on a presentation on healthcare advocacy for the Muslim population. My name is Dr. Bana Ode, and I'm a doctor of physical therapy. So a little bit about me before we get started, just really highlighting why this topic is so important to me and what's so personal about it to me. So I'm actually a graduate of Wayne State's DPT program, and I just graduated December 2021. And going into PT, I was initially just interested in healthcare. I had a prior interest in law, but I was still trying to figure things out. And I ended up going into PT after hearing about how some of my family members had an experience at PT where their health needs were met, but they felt like they were being disrespected because of their religious accommodations. And so it kind of met that desire for me to go into a healthcare profession. PT seemed very interesting. And then at the same time, it addressed that it addressed almost like that law side by wanting to bring in that advocacy. So that was something I was passionate about. So I ended up getting into physical therapy school, and my experiences in school, although many were very positive, there were definitely some that really highlighted to me and reinforced that this was a good decision on my part going into this field because that advocacy was needed. And it was something that I saw highlighted in different healthcare professions. And it became something that, every year I was in it, that drive to continue that advocacy really grew. As I was there, I was blessed to have a group of amazing classmates who were also minorities and interested in inclusivity, diversity, and equity. And so we created a student organization while I was at Wayne State. So we started Inclusivity, Diversity, and Equity in Action at Wayne State's DPT program. So my DEI, or diversity, equity, and inclusion work, is not just for the Muslim community, but it expands across multiple domains as well. And I've only continued those types of roles after graduating. So at present, I'm the Diversity, Equity, and Inclusion Chair for APTA Michigan, which is the APTA is the National Association for Physical Therapy. And I've won a couple kind of high profile awards nationally, including the Minority Scholarship for the American Physical Therapy Association, as well as a leadership award called the Mary McMillan Award. A lot of this started for me very early on. For a lot of students here, it's exactly where you guys are right now. So I was a second year student. And my journey really began, and the impact I had really began in me writing an article on the Muslim community. And even though our National Association for Physical Therapy has been around for 100 years, they just celebrated their anniversary in 2021. Mine was the first article to be highlighted that highlights the Muslim community in the entire association, like the only one to focus solely on the Muslim community. So it really just goes to show how much that advocacy is needed within our profession, and not just in physical therapy, but across the board. And here's just a couple of pictures. One of them is me with, this is the American Physical Therapy Association's president. So this was after I won my awards. And then up here, it's a little bit of a grainy picture, but this was me on stage at the Washington National Cathedral, giving opening remarks, introducing her. So it's definitely been, like I said, I just graduated in December 2021. So it's been quite a journey, being almost very high profile in terms of leadership as a student. And then at the same time, kind of juxtaposing that with being someone who's still fresh out and has a lot to learn clinically and things like that. So this topic is very, very near and dear to me, and it covers a lot of different, there's a lot of different nooks and crannies to this topic, but I really wanted to keep this talk pretty basic across the board. So our themes really are to underlie the importance of understanding our different identities as healthcare professionals and providers, and really knowing, really being able to put to words why being aware of different identities, whether they're cultural, faith-based, whatever they may be, why knowing about these and responding to them benefits every single one of us. And then I wanted to provide our audience with basic education and awareness of the Muslim community, and then ways to be an ally. And then lastly, listing ways to make your own workplace, so really just action steps to making your own workplace or organization more inclusive towards Muslims. So now going into why does this matter? So I'm going to address this from two main parts. One of them is more on the diversity climate, like or psychological side in terms of organizational psychology. And really this gets into diversity climate. So diversity climate are the perceptions of the degree that an organization is fair and accepting of all members of an organization, irrespective of demographic background. In other words, how much do people who are in an organization feel that that organization is accepting of every member that there is there? And this isn't necessarily specific to religion, but it could be to any identity. So if there is a single mom in a program, how much does she feel and how much do others feel that she's being accepted and respected within this organization? And how much is that organization being fair to her? And I took that definition from Patrick McKay, who is a professor on the topic. And I have for this, if anyone wants the PowerPoint afterwards, I have some of the links that I've used, those citations at the bottom. And really the cool thing about diversity climate is it's been found in the research that if you have a very positive diversity climate, it's associated with better work attitudes, job performance, and decreased employee turnover. And I mean, even at the school setting, what that means is that people are coming in happier, they're doing better jobs, they're being ranked higher in terms of like how well they're doing, and there's less turnover. So people are happy and they don't want to leave, which is all very good things for an organization. And to me, the part that I love the most about this is that these benefits of a pro-diversity climate are not just for minorities, that these are seen across the board, even among white majority individuals. So it gives you really a very compelling reason to think about and to think more critically about why should I care about really being accepting of everyone. It's not just to make that other person feel good, but there's benefits across the board for us all. And now kind of targeting the same question, but really more now focusing our lens on that Muslim specific lens. So by 2050, Muslims are projected to become the second largest faith group in the United States. And so as you have more Muslims in the United States, you're also going to see more patients, just respectively, that ratio. We're expecting to see more Muslims in clinics. We're expecting to see more interactions on a daily basis, in your classrooms, in your clinics, wherever your colleagues. And so it's important to be aware of this population. And then going more into the patient care side of things, really making sure that we're understanding and that we're addressing people as a whole. So things that are important to them, not just the diagnosis that they walk in with. And an important thing here is that when patients begin to perceive a poor congruency between themselves and their healthcare providers, they're more likely to delay care and then be non-adherent and be very distrustful of their healthcare providers. And I mentioned that I had only graduated in December. And I mean, even now, even being so like quote unquote fresh out, there is definitely, you already start to see examples of seeing individuals with very serious conditions and just having that conversation of, have you been to a doctor? Have you seen XYZ health provider? And then hearing from them, that really heartbreaking news that, I know that this is serious, but every time I go in, I feel like I'm being disrespected. I feel like I'm being mocked. And so it doesn't make me want to go in, as serious as this condition is. And, you really see the impact of that. And you only imagine, if you see that a couple of months out, what does years on the job look like? How many people are going through things where, if only we had a better congruency, a better respect of those around us, more inclusion, what would other people's lives look like? All right. So now going into more of the bulk of the presentation, going into now basic education and key considerations of the Muslim population. So one really important theme going across the board is that, and just something to remember as I'm going through the whole thing, is that not every Muslim practices Islam the same way. It's kind of the same thing as, we're all following the same constitution, but if you go state to state, person to person, wherever, it's, you see the manifestations of that in very, very different ways. And you see the interpretations of that in very different ways. And then there's, just variation across the board. So there are some very important, though, behavioral trends to be aware of in religious practice. And again, they may or may not apply, but across the board, these are the most common trends. So I'm going to go through, and these are the topics I'll touch on as we go. We'll go through religious values and demographics in the United States, modesty customs, spiritual practices, workplace and socialization considerations, and then I'll give you a list of action steps for your own respective organizations. So getting into religious values and demographic info, this is just like your, if we're going to talk about the Muslim community, I just wanted to give kind of a couple basics of what really what defines this population across the board. What are some of our main tenets, main things that we believe in before I get into the advocacy part. So for us, most people know this, but I figured I would include it. So we have 5 main pillars, so like 5 main building blocks of our religion. So one of them is our testimony of faith, which is the Shahada, just really belief in one God, belief that the Prophet Muhammad, peace be upon him, is his messenger. Prayer. So prayer plays an integral part in our lives. It's really important for us. And one of the article that I had written really highlights prayer and its importance for physical therapists to know about in terms of physical rehabilitation, like looking at our praying positions. But for prayer in general, we pray 5 times a day. And then there's other prayers like our Friday prayers and a couple others, but across the board, that's just a really integral part of our lives, and that we kind of take breaks throughout the day to get that meditative, that reflective practice in. Our third one is zakah, which is basically almsgiving. So it's kind of like a tax payment in a sense to the poor. So just that importance of giving back to those around you, to be generous with what, that sustenance that God gave you. That's kind of the concept. Fasting is one that most people are aware of because they've at least seen it in the communities around them. And that plays a really important role in terms of advocacy later. So I'll get into that a bit later. We primarily fast the month of Ramadan, which is 1 month during the year. And then some of the times you'll have different days of fasting interspersed throughout the year. And then last one is our pilgrimage, which is almost like a spiritual retreat of sorts. And that might be important later on if people are taking time off work, things like that, in terms of just this population. And now going into just general health or health seeking behaviors in this population. So in general, health is kind of perceived as some of the things that, and I'm taking some of this from words of the Prophet, peace be upon him, in terms of like this concept that every single illness or ailment has a cure. And so God has given a cure for every single illness or ailment. And so seek out those cures. So there's definitely pro-health seeking behaviors, which is just an amazing thing in this community. But at the same time, you'll see that culture can color that and can change that. So I've heard one person before say that culture is in a sense the vessel that we hold all of our values in. So whether that's religion and whatever it may be. So if like your religion is the water and the culture is like a vase that it's in, it can take different shapes based on your own culture, different manifestations. So just keep that in mind, and that how that may affect people. But in general, our own beliefs, like a lot of the times health supersedes things like modesty, things like that. So it's a very, very important thing to us. All right, so now going into religious values and demographic information. And I'm doing this specific to the US. So the most important thing is that it's not obvious all the time that someone's Muslim. So not everyone's going to look like me, where it kind of stands out with the hijab that they're wearing that they're Muslim. A really important thing is that Muslim is not synonymous with Arab. And that's something, even after writing my article and being very deliberate about making sure I wasn't conflating the terms, I still had a population who thought that my article applied to Arabs, and I had to kind of clear things up. So just know that in general, only about like less than 20% of the Muslims in the world are Arabs. A lot of the times people think of like Saudi Arabia, that's only about 2% of the world's Arabs. So just know it's a very, very diverse community. And in the United States, this is an important piece that's often overlooked. About 1/5 of Muslims are African American or Black. So whether they converted down the line or whether they came here from Africa as Muslims and continued that, we definitely have a large population that's very often overlooked because people will automatically assume Arab and then by default ignore the rest of the population. So for all of this, I think the most important thing to reflect on really as healthcare providers is that in general, when instead of making an assumption about the person in front of you, about anything related to their identity, it's important to just kind of fix in or like put in questions that allows you to understand more about the person in front of you without making maybe damaging assumptions. So for me, I kind of promote putting in something as simple as asking, is there something my team or I can do to make you feel more comfortable? Or are there any values or any things you want us to know about before we begin our treatment, or, maybe prior to you starting a program? So that this way the person can explain to you something, you're showing them that you're valuing whatever change or difference that they're bringing to the table, without making an assumption that, you must be doing something a certain way. Do you want XYZ? And now we're just keeping it, an open conversation. What would you like us to do? We would love to do that for you, but just, opening the door to that conversation. All right, so one of the main, this is going on to our second point, which was modesty customs. This is one of the main characteristics in Islam, and this isn't just addressing something like physical modesty, it's also spiritual and kind of psychological as well. So really just carrying yourself with humility and how you perceive yourself and how you perceive your role in the world. And that doesn't mean underachieve, it just means that it's kind of like putting your ego in check a little bit. But I think for the most part, in terms of patient care, we look a little bit more at the physical modesty side of things. And so in general, these modesty principles physically, we try to keep ourselves covered, try to keep a distance in a sense between the sexes. And so in general, as a trend, again, doesn't apply to everybody, a Muslim patient will prefer to be treated in a private area by a therapist of the same sex. And those modesty principles, by the way, apply both to men and women. So for this, asking for a consent before exposing any part of the body, explaining what's going on if that tends to be a situation that comes up. So, and it's going to differ based on program. I mean, in physical therapy, it comes up a lot. And so these are common questions and conversations to have with people. But in others, maybe it's something as simple as blood pressure or something like that, but just to make sure that, you're actually having that conversation. And then another one for a lot of healthcare providers, even if there's no actual physical contact, just making sure that you obtain consent or announce your arrival when you enter a room. So I've seen before in a hospital where people just, they're rounding, they just kind of barge into the room or just give a quick knock and then just show up. And if there's a patient like myself, for example, if there's a male physician or pharmacist or whoever's walking in, I would want them to, I'd want a little bit of a heads up in case I want to cover myself more fully, but just really extending that respect to the patient in front of you. And now going into spiritual practices, I highlighted three main ones that affect daily life a lot. So the first one is prayer, and we kind of talked a little bit about it. So we pray 5 times a day, and the prayers are interspersed between, the easiest way to explain is between sunrise and sunset. So you'll have 5 prayers, one's at the beginning of the day, one's when it's nighttime, and the rest are throughout. So depending now on the time of year, so if it's in the summer, sunrise and sunset are very, very far apart, versus in the winter, things are a lot closer together. So what that would mean for me, for example, is if I'm taking a prayer break right now during the summer to pray at work, I might just need one break for the amount of time I'm spending at work, versus in the winter time, I might need to take 2 or 3 breaks because the prayer times are a lot closer together. So making sure in your different organizations that you're allotting time for prayer. So usually a person might need, say, like 10 minutes, something like that. Making sure that you have space for it. So, and it doesn't have to be, I don't know if you guys have seen Wayne State's reflection room on main campus in the student center, but it doesn't have to be anything fancy. Like if you're in a workplace, an office space works, just something that's closed and quiet, preferably, because it's like almost like a meditative practice. So you kind of need that quietness, that time to reflect, that time to really be focused and engage in that task. I really love the reflection rooms at Wayne State, and I think Wayne State's done a really good job of making sure those are throughout every single building. And I just saw an article from them recently showing how they're expanding it across multiple different buildings to not only normalize the fact that people are praying or people are reflecting, no matter what their religion is, but to kind of encourage people to take that time for themselves as well. And here I did want to talk about a couple of clinical examples that I've had as a student and then as a professional now working. So I've had, and these are pros and cons, right? Good and bad experiences. So I had one at one point in like my second to last clinical rotation as a student. So I'm almost out, I'm almost graduated, where I was given a very, very hard time about the fact that I wanted to take a break to pray. And I do remember distinctly that the male clinical instructor, the preceptor, was telling me that, I'm going to have to figure this out because I can't be taking breaks that nobody else is taking. So if I'm going to enter the workforce, that's my own burden to bear to figure out how I'm gonna possibly fit in a 10-minute break that's outside of my lunch. Like he couldn't understand why I wouldn't pray at lunch when the prayer time did not fall into my lunch break. So, and as a student, your hands are tied, so it's definitely hard to be in those types of situations, knowing that, you know, if you spend too much time praying, then you might be looked at as somebody who's not managing time well, even though, you know, you might be, but you're, you know, you just have a different task to attend to in your daily life that's a little different than the white male, for example, who seems to set the standard for everything in our workplaces. And then the more positive example I had was just recently when I took on my new job. I decided to speak about prayer very early on, which I do for everything, but I was more deliberate about it. And my current boss basically told me, she said, you know, this isn't the same example, but when I was breastfeeding my child and I had to pump breast milk, I needed to take breaks and I had to take those, right? Those are important for me to take. And so she told me, we love breaks at this facility. If it's something that you need to do, take those breaks. So, you know, you might say, well, breastfeeding or pumping breast milk is a little different, obviously, than prayer, but it really kind of touches back to that diversity climate thing that, you know, we're valuing the person in front of us, whether this is a new mom, whether this is someone who needs to take a break to reflect or to meditate or whatever their practice is, and we want to give you time. And if those people, you know, if you feel accepted and you feel like they're valuing you, then you're just going to put so much more effort into your work, put more, you know, you're going to feel happier at work. It's going to really change that dynamic. So whereas one person, like my clinical instructor, would look at it kind of very strictly as, you know, I work 6 hours and Benna had to cut out 10 minutes from that. So therefore she's doing less, kind of really seeing it as being a more flexible thing. Like we're doing the same tasks, but she might need something else to put her in a better mental space or to care for her family or to, etc. So just really looking at that as a broad picture. And I'm sure there's a lot of other examples, even outside of religion, where people might need to take those breaks, have those individualized needs, and that it's really important for us to respond to those. Another part is our ablution, which is wudu. This is really the practice of cleaning or cleansing the body with water in preparation for prayer. And I've heard it be described before as like almost like a ritualistic cleansing. Things don't translate too well between Arabic to English sometimes, but the general idea is that you're almost like rinsing your hands, mouth, nose, face, forearms, hair, ears, and feet. And so, and cleanliness, in case you couldn't tell, is very, very important in the Muslim faith. And so really for this, I think the most important application is really just making sure to have an allotted space for this if you're able to, like if it's a new building being just constructed, or at least to have like a private bathroom or something. So for me, usually like a private bathroom is one of the better spaces. It can get a little awkward in public if people don't know what you're doing and it's like a large restroom. So just making sure that you, if you can, to allot those spaces and to just have an understanding of, you know, this is something that people are engaging in and this is normal for them. And I'll just go in and show the picture first. This is really grainy, but it was a nice picture from online. So this was from a university in Utah, and they had a campaign called Don't Hesitate to Meditate. And again, usually like just like with a reflection room, they won't tie a specific religion or anything like that to it because it should be open to everybody. So with a lot of these, they'll call it reflection rooms or meditative rooms and things like that, just to make sure that, you know, for whatever reason, if you need to meditate, you just need some quiet time to reflect, that this is a space open to everybody. So for this, you can kind of see that they have like their faucet area here. And by the way, Wayne State's undergrad like student center has a really great one that I believe it was like U of M Ann Arbor, one of the U of M's came out to check out to kind of recreate in their own facility. So it definitely applied the undergraduate programs really for doing that. So this one just has a little sitting area, has a faucet available. It's in a kind of closed room. And so this way it makes it easier for people to do that cleaning process or that wudu. And again, this is like a fancier, definitely thought ahead kind of a process, but something as simple as just a private restroom would work. All right. And then the last one, oh, and by the way, in terms of allotted time for prayer, a lot of the times I would say for most people, like if I was advising somebody to take time, I'd usually say about like 10 to 15 minutes just to include time for doing that. We'll do it if you need to, and then going into prayer. Last one is fasting. So this is done primarily, as most people know, during the month of Ramadan. the month of Ramadan kind of changes throughout the year because our calendar is based on a lunar calendar. So each year it's about 14 days earlier based on the calendar that we use more commonly. There are some other days to fast, or if you just want to fast, you can. So you might not see, people don't only have to fast during the Ramadan. So there might be days throughout the year that they choose to. I know individuals who try to fast on a weekly basis, like at least a day or two during the week. So it can definitely differ there. For this across different healthcare professions, just to understand that it could affect things like medication compliance, when people are scheduling appointments. So for me as a therapist, as I was working, I had a couple Muslim patients and I was expecting them to have a harder time to come into their therapy sessions because of fasting. You know, you're going to be tired. It's going to be a little bit different for you, just how your day is structured, you know, without food or water, you're going to feel differently than you do on a normal basis. So for them, for example, to accommodate, I set up a home exercise program pretty early. I was very flexible with times, and our facility was open really early and really late for individuals who wanted to come in. And that was just how our normal scheduling was set up. And then other examples, just to give you a bit more of the personal side of things. So for me at work and also during school, it could be a tough time. So it's a very rewarding practice and something most Muslims really do enjoy after they're into it. But there's no doubt that if you were to suddenly cut out food and drink earlier on, you know, your first couple of days, you know, you're going to get that caffeine headache if you drink a lot of coffee and things like that. So you might not, you know, it's tough to first transition into. So for me, with classes, it made studying harder, it made test taking harder. So those are things to keep in mind, even in terms of just like the timing of classes. And then in terms of work, for me recently, this is more of a reflection on I think a practice I wish more people would do. But so for me at work, I was working and then the month of Ramadan hit. So I was fasting and I just thought, you know, I'm a couple months into work. Maybe I shouldn't make this a big deal. They kind of know about things. So I'm just going to keep it kind of, you know, just kind of do my thing. Well, in the month of Ramadan, they also ended up, you know, I was kind of building up my caseload and they ended up doubling my caseload during that month. So that transition period was absolutely grueling. It was some of the hard, like it was just emotionally, mentally exhausting to be able to double what you were doing on no food and no water during the day. So that was something that I realized in part had to do with me, like me being able to, or me kind of making sure to express, even though I thought it was a little obvious at the time, but making sure to express to people that I'm going to be tired. This is going to be tougher. So just make sure that as we're making changes, give me a heads up so that we can work this through. And I also think in terms of a practice, I think it's really cool in the moments where I've heard where people will do like almost like a buddy fast if their health allows or their schedule allows, to try to get a feel for what it feels like to be a Muslim during those times. And I know people who've tried it and who've loved it, and a lot of people who've tried it and just been exhausted. But I think it gives you really that empathy for the people around you, whether that's your coworkers or that's your patient. So you start to understand like this is what they must be feeling like on a daily basis. Even though it's very rewarding, it can be very tough. So I think for me, at work, I couldn't really suggest it. I think I had spoken to a friend and I think it's more of a thing that other people would almost volunteer themselves for rather than be told to do. But I think that practice is a good one to consider, whether you even just do it once in your life, just because, you know, it gives you such a great sense of empathy for those people around you. So pretty much it on fasting. Oh, and recently I've noticed fasting has been a little bit more accepted. It used to be such a weird thing that people, you know, the joke is it's always like, oh, even water, like you are really even water, are you sure? And we're like, yes, even water. But I think it's become a little bit more almost mainstream just because of intermittent fasting, which is different, but people are a little bit more accepting of it or familiar with it, I should say. So they kind of have some idea that can be a healthy thing for you if done in moderation. And so it's an easier thing to explain nowadays, but in the past, it was definitely something that you almost felt really shunned for, that people are like, well, they're crazy. How could this be good for you? And then, you know, it becomes like more of a mainstream thing. And then all of a sudden they're like, oh, of course, this is great. I do it too. So it's, you know, I think that made it easier, but in a way it was interesting because there's a lot of practices out there where it might seem crazy to you on the surface, but we're telling you, like, we know it's good, or, maybe other cultures or other groups, whatever the practice may be, have a very different personal experience. So just keeping an open mind is really important. Okay, so getting into action items now. I wanted to start out with prayer, and these are really things to apply, whether it's a workplace, your school environment, or whatever it may be. So going into prayer, I talked about a few of them, but looking at having reflection rooms or just a quiet space for prayer, and a space for ablution or wudu for that, cleansing ritual, and then having to make sure to be respectful to that time allotted. What I've given as an example, I don't like to pit different professions almost like there's a hierarchy, but I've kind of explained it to someone before, saying, I've seen at U of M, at one of the U of M hospitals, where the neurosurgeon was taking time off to pray and lead prayer. And so if his job is an emergency, or if in this situation it was a he, so if his job was an emergency, my job as a physical therapist is definitely not. We're all very important in terms of health careers, but there's some careers where it's like, oh shoot, you're on the clock, like you need to be here. It's an emergency, you got to come. Versus like mine is definitely not that. So, if he's able to allot time for it and they're accommodating of his schedule, we really need to be a little bit kinder about it in terms of just other people's in general, across the board. And then another one to keep in mind, I didn't talk about this one specifically, but for us, just like how there is Sunday church, very commonly, we have Friday prayers. So Fridays is one of those like holy days in the week. So we tend to do a sermon or a lecture, and then a prayer in congregation. So a lot of people I know, it's very important for them to go to those prayers if possible, or to have those prayers with their coworkers. And so just understanding that, maybe being a little flexible with your hours, if someone works an hour later, to give them the hour off. Just something like that. And then across the street, this was at Eugene Applebaum, this was at the DMC. They actually have a reflection room there. And so there were a group of physicians and nurses who would lead prayer. And so they actually hosted their own Friday prayer there, which was a really, really cool practice. It was tough to be able to attend and to know the schedule, but just that, if the door is open to doing those things, those are definitely things that are amazing to include in a workplace, or at least to allot the time for people to participate. Going into diet, I didn't highlight it earlier because it tends to not be too big of an issue nowadays. But having, like, in conferences, if you're catering any events, if you're hanging out with people, like whether it's you're doing some sort of a hangout with your class or your coworkers, just making sure that you go to a place that has halal options, which if you're living in an area where there's not, at least something like vegetarian, something that you're making sure that people across the board can eat. I say it's not as much of an issue now, because a lot of the times now you'll have at least like vegetarian or vegan options, things like that, to be more accommodative of people across the board. So usually if they're accommodative of those things, there's at least stuff that we can eat as well. But I've seen some places be a little more forward, where if you're going to a conference and they're asking for, dietary preferences, they'll actually have an option that says halal. And halal is just, by the way, it just means permissible. It's really just, so in Islam, it's okay to eat different types of meat, not including pork. And then there's just a certain way of being almost respectful to that animal that you are slaughtering. There's a certain method of doing it, in order to like kind of be the most merciful on that animal. So that's kind of the concept behind it. I'm not going to go into any details there, but just that's the concept of like what that word means. Next, going into holidays, really our main ones are Eid, which we have two of them. There's one right after Ramadan, called Eid al-Fitr, and there's another one called Eid al-Adha, which is just a couple months later. So just making sure that if somebody has or needs time off for a holiday, that we're respecting that. A lot of the times, it shouldn't be this way, but a lot of the times I've seen people give other, maybe there's an exam on that day and nobody wants to change it. It's more surprising how much trouble people can give you for these things, even though, you try to, which a lot of times the most common one is Christmas. You're like, well, Christmas, everyone gets the day off. This is as important to me as that is to you. Can we get this day off? And then they'll say, you should have told me more ahead of time, or, we've got this going on and I can't change the date. So you get levels of accommodation on both sides. So there's the group that's very, very easy about it, and then some who give you more trouble than you would have expected. And I think in healthcare, a lot of the times they so encourage us to be so it's like in a good way, in a sense, that you need to be very patient oriented and things like that. But at the same time, even if you're an emergency room physician or or an emergency room nurse or somebody who has like a very intense job, it's important that, like, in terms of time, it's still important that, we're respectful of those needs that they have, because they're people too. They need those breaks, just like you want your break on Christmas or things like that. And I think actually the way I kind of pitch it in a workplace is, I think it's really amazing to have a diverse group, because especially if you're working in a setting where maybe it's in a hospital and you don't necessarily get you don't get Thanksgiving off or Christmas or things like that, because there's people there, still at the hospital. So in settings where you have a good diverse group, then, maybe I don't celebrate Christmas at all. So I'm happy to work Christmas. So that gives people who want to spend that time with their family an easier time to take the day off. And then in turn, they can work in my spot when I want to take my own holiday off. So I think that back and forth really works well. And then lastly, in terms of alcohol-free options, that's something I've been recently working with the American Physical Therapy Association about. And it's actually been one of the toughest reflection points, because for whatever reason, it's a very, very personal topic to many people, and they don't want to give any sort of drinks up anytime that there's events. So for me personally, a lot of this started where, for those awards that I had mentioned to you, I was invited to different ceremonies, and the ceremonies included drinking. And I just said, and each person's going to be a little different in terms of their comfort level or the amount of insistence that they have that they don't want to be around alcohol or don't want to drink. So those personal differences definitely are at play. But for me, I prefer not to, for example, be in a room with alcohol or be in a room where people are drinking. So being able to even find time to hang out with people where there are alcohol-free spaces is just almost impossible. So down to events like award ceremonies, like places where I'm supposed to be honored during an event, they'll sometimes very closely tie alcohol to, and then you almost have to pardon yourself from those spaces because, ironically, even though you're being welcomed into the space, you're almost being shunned from the space at the same time. So a couple options in terms of action items that I've promoted with different groups successfully is so kind of having some flexibility. And this is not just for Muslims, but for any individual who may choose not to drink or may choose not to be around alcohol. And so things like making sure that you have, or that you ask if people would like alcohol-free tables. So I've seen one of my friends at Wayne State's School of Medicine had sent me an example of, this was towards their match day or one of their bigger events, where they specifically said, if champagne is served, this was on like their questionnaire, if champagne is served, would you like to be at an alcohol-free table? And so people got the choice, and it was normalized from the start to say, yes, I would like to distance myself from this. And so in that way, both sides or both parties were kind of appeased, where, if you wanted that side of things, it's there for you, but if you wanted to be apart from it, you have that option as well. And it's done in a very respectful manner, which I definitely liked in terms of tone. And then there's other ones where, say that there is an event and people do choose to attend and they don't want to drink, just making sure that you have options available. There was a reception done by a group from the American Physical Therapy Association, and the change that we really talked about was making sure that your non-alcoholic options are just as appealing as those that do have alcohol. So instead of just being like you're drinking or you have water, you kind of mix it up, make it a little bit more fun for people who are going. And that could even apply for anybody who's, potentially even struggling with any sort of like alcohol abuse issue or the potential for it. And just making sure that they have something where they feel comfortable and it's easy enough to stay away from something that they want to stay away from. So, and I think that again, is in a way where we're respectful of individual preference of like how far you want to be from the alcohol or how close or whatever. But at the same time, it's enough that, you're not taking over. We're not saying that everyone should not have alcohol at an event but you're opening the door to at least understanding or appreciating that some people may not want something that you want. So those were the main ones there. And like I said, this was the toughest one because anytime the topic came up, as one person put it, she told me that it's almost like you're trying to steal their firstborn child from how intense it was. And by the way, she's not Muslim, she does drink, but she said it's a very, very intense relationship there. So it's a very tough thing to kind of try to push it, almost people feel like you're trying to take it away from them. But I really would hope that these options seem open enough that we're not trying to take things away from others, but really just trying to invite more people to the table in a way that's respectful. I had also, sorry, the last part was for this, forgot to mention it earlier, was, for example, in a situation like an award ceremony. So in one of them, it was just a coincidence. It wasn't the intention of them to separate an event at all, but what they did is they had a reception with free drink tickets at a hotel. And then the award ceremony was like inside, that was like outdoors or something. And then the actual ceremony was in an hour inside, and the drinks were not allowed inside because of COVID. But it ended up working out so well because I was invited to this award ceremony in DC. And so what I just did, I came in, got my stuff, skipped out on the reception, the part that actually included the drinking. And I was still able to feel like I was being honored in that way. And it was a fun event for me. And at the same time, each party got what they wanted at the same time. So if you wanted the drinks, they're there for you. And then if you don't want to, you're still able to be an awardee. You're still able to go to the main event. So it was definitely a cool way of things working out, even though the intention was for COVID, not necessarily as a religious accommodation. But I really love that example. This is an example actually by a PT who did this. This was back in 2020. I think she had one for 2021 as well. And she just kind of put together just kind of a quick thing of like, share this with your workplaces. This is why we fast. Here's a couple main points. And so these things are online. So that's the cool thing about following different people on social media, is that you'll get different examples, and it's very, very easy to integrate. So I do see I have a couple of things in the chat. Let me address all of these at the end. I feel like a professor going through these, and I don't know where that screen went, but it's okay. We'll deal with it later. Sorry, I'm wrapping up real quick right now, so I'll just address those in a couple of minutes. So personal experience wise, this is more around the school setting, and I've had the privilege of really being a mentor to a group of different Muslim students in physical therapy specifically, just because that's where my own interests lie. And a really common theme, and it's something I went through, is kind of, there's individuals who are extremely supportive, and then there's individuals who definitely give you a hard time. And unfortunately, that's a theme that I've seen across the board. And, so for example, going into PT school, just to give you an example of how things are, it's a pretty hands-on profession. So I went in there and I said, I'm going to go in, and from the start, I knew I was going to be assertive about respecting my hijab, respecting exactly what I believed in. And so I went in and I requested, on my first day of school, I requested to have a privacy screen to only work with female lab partners, where I was able to work on the female lab partners and on the males if I wanted to, but the males were not allowed to work on me. And then the third one was to always have at least a female TA available. So if I needed to get any feedback or anything from somebody, that I had the option of somebody else who I felt more comfortable with giving me feedback. So that was the first time in Wayne State PT where someone's had those accommodations and really stuck to them as strongly as I did. And I think, like I said, that's where the advocacy part came in. I kind of went in knowing that I was going to be a little bit more assertive. I wasn't going to just blend in with everybody else. And, things went, the program it was amazing at first. They really came in and said, this is an amazing experience for everybody because, and that's shout out to Dr. Tina Reed. She's amazing. So she kind of went in and told everyone, this is an amazing experience because it shows you exactly what your patients may look like, but you're learning it in the classroom. So that was instantly a way of normalizing exactly what I was doing and being respectful of it. So it made me feel really good about it. It kind of gave the classroom the exact tone and the exact expectation for how things were going to go. And so that was a very, very helpful thing. But along the line, I definitely did have my struggles. So I had a moment where I tried to change around a certain lab experience. I'm going to be purposefully vague because if anyone's in physical therapy, they might recognize it. So I'm going to be respectful of all parties. So I had a certain lab experience where I had to say, can we change this up? Because I'm not going to be comfortable with the men in the room and being dressed in this way. And that lab instructor had told me, you're being a burden to the rest of the class. And that was in my second year before I had written my article. And so that really, really affected me. And you might even be able to hear it in how I'm telling the story. It was definitely a very personal experience. And that actual lab instructor was my favorite lab instructor up until that point. And so it was definitely a hard thing to have to deal with, somebody putting that in your face. And, being and almost just feeling like, maybe I need to switch professions if this is how tough it's going to be on a daily basis for me. And without a doubt, it's still tough in the workplace. It's an uphill battle for sure. So, and I've had a lot of people share those same experiences with me, where I had an individual who wanted to start wearing her hijab, her headscarf, and her program, this was in a different state, but they had told her, you need to choose between your education and your religion. So these two are not compatible, is what the message she was told. And you always see, and anytime these stories are told, that emotion that comes out, that some people that you thought you could trust come in and turn on you in such a way. So this is such a personal experience for me. It's such a thing that I'm very passionate about, because for me, especially now, being in a position where I've graduated, I've achieved quite a bit of leadership success in the profession, to be able to say that things as they were, even though that was our status quo for the longest time, and it's not a very diverse profession, physical therapy specifically, that I am a testament to what is possible in our profession and in other healthcare professions. So if something as physical therapy, we can do it fully covered, we can do this in other places as well. We can be respectful to our patients as well. It's not that it doesn't make your job harder. It's not the end of the world. And, just really, it comes from such a personal place, having experienced that struggle, and then being able to go forward and send a message to say that all of this is possible. We can do it. We just need to make the efforts and educate ourselves to do this. So thank you all for joining me for this. I do have a couple of resources for you because, like I said, I'm really talking more about like your general kind of common themes, but there's of course going to be more specific considerations if you are, for example, a physician, or you're in pharmacy, or all these other professions that you might have questions come up. There's a great resource called IMANA, which is the Islamic Medical Association of North America. So they'll do different, they have like a resources page where they'll go through different things about Islamic principles, some things to educate Muslims on, and some things to educate healthcare providers on. So they're just an amazing group. Related more into mental health related to the Muslim community, which is under-researched. I think it's really cool for some of these to be able to get information from the source. So one of them is the Khalil Center, which is an online psychology group really that mixes Muslim mental health as well as like your common, more like secular clinical psychology sort of a route, or counseling sort of a route. So this is available if someone needs counseling or anything like that, but wants it to be reflective of their own Muslim background, or wants it to be responsive, or to have a therapist who understands that side. So that's a great resource that could be students, coworkers, whoever it may be. And then the Stanford Muslims and Mental Health Lab is an amazing resource. They're on Instagram and a couple other I'm not too active on social media, but they're very active. And so they've got research that they're generating on the spot in like 6 different paths, like related to Muslims and mental health. And it's specifically in the US. So it's just amazing to be able to read those and to see the statistics and to see them addressing a population that has not been addressed very well in the past. And then I've included my own article on what I wrote for the American Physical Therapy Association. I think you have to make a login to get to it, but, and it is very PT specific in that I address like rehabilitation and prayer position and things like that. But just know that it's out there in case you would like. And then I have just my contact info. That's my personal email for any questions or comments. The only social media I'm like kind of sort of active on is LinkedIn. So if you want to reach out to me there and have those networking opportunities, I would love to get to know you guys if you have any questions. So, all right, now I'll open up the chat. And I wanted to say also, thank you so much to the Pathologist Assistant Student Organization for having me. I think it's amazing that you guys started an organization, and that also comes from a really personal spot because I went through the trouble and the difficulty of having to start one in PT. And also it's tough to take a step back when you've graduated. So honestly, good for you.
Bon, I just want to, sorry, Jennifer, I just want to say, I'm the director of the PA program. So
Hello.
as an instructor and as the director, I have learned so much today from your lecture, from your talk. It's incredible how much we all have to learn. And I hate to learn from my mistakes, but it is from the mistakes that we do learn quite a bit, right? But I feel that I thought I was fairly educated in regards to our students and our diverse population and how to be accommodating, and I feel like I wasn't. So I will start my class tomorrow by apologizing to my students because I've learned a lot from you today. So thank you so much for educating us all. I on my end know that I appreciate it very much so.
I appreciate that. Thank you so much. And that's definitely a vulnerable thing in front of your students to take on. So that says a lot.
Oh, they know I'm always for the truth, so I'll be the first one to to admit to the shortcomings. So no.
I think Professor Kramer said it best. We all learned so much here today, and thank you so much for doing this for us. This was a topic that I really wanted covered since I started working with the Diversity Initiative for the PA program. So I am really just overjoyed that this has happened, and you have just shared so much knowledge that is so valuable, and I'm so excited to share it with the rest of the programs in the college. So thank you so much, and thank you for being so vulnerable yourself and for sharing your personal experience. It was really enlightening, just amazing. Thank you.
Thank you.